Good afternoon, everyone. Welcome to our COVID-19 update for Eau Claire County. We're happy that you've joined us and are here to get updated information and the current information about what's happening across the state and in our community. Today is Monday, August 31st. Hard to believe that September 1st is tomorrow, kind of the day that we all start thinking that it's not summer anymore. For many, the school year starts, either has already started or starts this week or early next week, and that's also a transition time. Shortly, many kids and young adults will be going to school. We know that the schools have been working really hard all summer to be ready for these days of start. Given COVID-19, we know that school will look different for our young people and our college-age students. And different isn't necessarily bad. Different is going to take some adjustment, and we really appreciate the hard work that everybody's doing to make those adjustments, whether they are the students, the family members, the parents, or the staff and faculty that are in all of these schools that are having to adjust their way of doing business. We're excited to work with them, and we are pleased that people are taking those steps that they need to take in order to be a bit safer given COVID-19. School year start is a challenge every year, and we know this year that there are people that are concerned about what will happen, worried about safety risks, and also worried about change. And we really want to tell you that we've been working carefully with schools. We know, again, that there will be some bumps in the road, but our goal continues to be to keep the case numbers as low as possible so that we can keep as much in-person school happening throughout the course of the fall. We'll share some more updates about that shortly. We'll also today have a little bit of a mental health update, as we do every Monday, and share some basic data. So to start, our state update for data related to COVID-19, we have now 1,172,854 negative tests for COVID-19. Of the people in Wisconsin, 75,603 of them have had COVID-19, an increase of 266 individuals since Sunday. Of those people, a little bit more than 5,800 have ever been hospitalized, 5,817. We do have 1,122 individuals in Wisconsin that have died related to COVID-19. Over the past 2 weeks, there have been on average about 718 cases a day in the state. The positivity rate over that past 7 days is at 8.3%. That is as of yesterday. It's been on a slow increase in the last 2 weeks when positivity rate was 7.3%. In Eau Claire, we've had 17,509 negative tests for COVID-19, an increase of 51 negative tests since Friday. Positive cases are now at 801. We've had 21 positive cases, people with COVID-19 since Friday. We are still at 6 deaths of Eau Claire County residents and 38 individuals who have been hospitalized. Of the 801 individuals that have had COVID-19, 702 have recovered, according to the state definition. Jail data, which we report every Monday, we also have 133 individuals have been tested connected to the jail, with 7 positives and 7 recovered. A few data updates on our website to make you aware of. Again, that website is covid19eauclaire.org. It does have a lot of information on it. We encourage you to spend time there. Not only is there data available, but all of the basic resources for individuals, families, businesses, schools are really posted at that site in a resource page for you. On that site, we now have mapped the cases by municipality on the home page of our website. As we've gotten higher case numbers, we've been able to map those to show where in Eau Claire County those cases are. You'll notice that in some municipalities and some locations where we have fewer than 5 cases, we don't give the actual count. So if it's between 0 and if it's more than 0 and less than 5 cases, we don't give the actual count, but otherwise the actual number of cases per municipality or area is given. This is the same as the state health department does with their map data that they do by census tract. We've had a number of requests to have data by municipality, so that is meeting that request that people have had. We'll also start to incorporate more data from the state in our Wednesday metrics, which we'll talk about this coming Wednesday. Information about schools is also something that I know is top of mind for many people. We have been working carefully with schools and have a number of resources and materials available to school partners, to families and parents, as well as resources that the school and the health department are using to look at the health status of individual children and follow the data. Really, the work is at all levels of education, so K-12 as well as our collegiate and university level. We know that working with Department of Public Instruction, working with the UW system, working with the technical colleges and the specific schools in our area is really critically important. We have a COVID-19 toolkit for schools, which we've developed locally to have as a resource for all of our K-12 schools, and that is available under our Child Care and Schools tab at our website. One of the things that we are working carefully with schools on is making sure that we don't have outbreaks there. We know we'll have cases in both the student population and the teacher and staff population. Our goal, again, is to keep the circle of spread as small as possible. And we are counting on things like physical distance and mask use to decrease the number of cases that we have. One question we often get is about how long children have to stay home if they are identified as being symptomatic and or as having a case. This is a complicated process like we've talked about before, but a positive test for COVID-19 will result in that child or that staff person being out for the usual isolation period, the 10 days plus, in order to get to the point where they are no longer infectious. Anybody that's a close contact of that positive tested case would also be out for 14 days for quarantine, like we've talked about. We would work carefully with the school and the family on who is considered a close contact, both the family household contacts as well as those that are in close contact in school. In the school setting, for children that do have a set of symptoms that are COVID-related, children will be also excluded from school if they have those symptoms and are not tested. They will be assumed to be probable cases of COVID-19 if they have not been tested, and those children, as well as their close contacts, will also need to stay home from school. This is the recommendation of the state and will be a challenge for all of us to implement, but do know that our goal is for every kiddo that has symptoms of COVID-19 to get tested. If they get tested and are negative, then those close contacts and family contacts don't need to stay home, and the child just needs to have symptoms resolved like they would normally do for any illness and be back in school. If they're positive, the same process that we have for any other COVID positive individual would be in place. If they're not tested and they have COVID-like symptoms, they will be excluded, as will their family members and siblings from school, as well as family members staying home from work. So our goal, along with the schools, is to get kids tested so we can keep kids at school and we can keep parents working. We're working with the schools on a testing plan and working with our healthcare providers on testing. We are confident that there is testing available in Eau Claire, and our healthcare providers have indicated that. So we really want to make sure there are no barriers for individuals to get tested as part of the process to make sure kids stay in school. We'll shift now to Luke Feedy, who's here from Behavioral Health in Eau Claire County, and he'll share a little mental health update, and then we'll close with some final comments and questions that we've gotten in advance, as well as remind you of our next time together. So, Luke.
Thank you, Liska. Happy Monday afternoon to everybody. On a global level, COVID-19 fears have created serious emotional distress. The isolation created by social distancing has been upsetting for many and has intensified existing mental health conditions such as depression and anxiety. Feelings of uncertainty and hopelessness are often exacerbated by COVID-19 and have left many of us wondering what's the best next steps as we move forward as a city, a state, a nation, and as a world. I can say it's safe to say that this pandemic has not made our lives any easier. We as humans like things to be predictable, and we often work to have some semblance of control over our own lives. So with all that being said, you may be wondering, what can I do? This will be review for some, but certainly some things that we can practice to make lives easier. These are some small things that can have a lasting and large impact. The first is limit exposure to COVID-19 news and rely on only trustworthy news sources. Staying up to date with the right information will allow you to make informed decisions for you and your family. It's important to allow yourself to be informed, but not overwhelmed. Don't let it consume you. The second is find ways to connect socially and limit your isolation. This is all important to do while still adhering to social distancing. We have the technology now to stay more connected to one another than we have ever been before. When used in appropriate ways, these technologies and these platforms can allow us to stay connected and stay current with one another's lives. Third, engage in mindfulness and other mental health promoting activities. There are many apps, videos, tutorials that can help someone learn and use mindfulness techniques. Things like meditation, guided imagery, and connecting with nature are all low-cost things that are highly effective. And last but not least, monitor loved ones and ensure that those struggling feel supported and loved. Ask those you care about how they're doing. It's a simple gesture, but can make a large difference in someone's life. Most importantly, don't forget that there are people all around you that love you and care about you as well. If you need support, now is the time to reach out to those friends and family members. And now is the time to make sure you're accessing those supports that are available to you. Thank you in advance for all of your willingness to support one another and to reach out if and when you're struggling.
Thanks, Luke. It's always good reminders that we get on Monday from Luke. And I think remembering the positives is critically important. For every challenge that we have with COVID-19, I see every day the positives that are happening in community connectedness and in people caring about one another. Simple things like people wearing a mask and reaching out to people that may need some extra support. So even though we have more than 800 cases, we have thousands of people in this community that are healthy and moving forward in ways that are productive. So good to remember for all of us. So a couple of reminders. Our website again is covid19eauclair.org and our call center number is 715-831-7425. We did get a couple of questions in advance that I'll share with you and respond to, and then we'll open it up for questions for those that are here today. So first of all, cases related to UW-Eau Claire and how will those be reported? We do know students are arriving, have arrived this weekend. We've been working with UW-Eau Claire on cases not only of their faculty and staff, but of the student population that is here. We will be working with UW-Eau Claire as they are working to draft a dashboard. We will continue to report all COVID-19 cases in Eau Claire County. We're working to make sure that UW-Eau Claire students identify a local address so that they are not identified as someone from Illinois, for example, even though they live here in Eau Claire because they are a UW Eau Claire student and happen to have an Illinois driver's license because that's where their original home is from. So we're doing work to make sure that UW Eau Claire students are identified as Eau Claire County cases, and we will be working to try and make sure that we have some information available on UW connected cases. It is difficult, so I will tell the community that there is no clear information available because, of course, faculty and staff may not live in Eau Claire County, and students may not live in Eau Claire County. And the challenge with our data reporting system is that cases are reported based on the location you live. We don't have a separate field that we can sort cases by UW Eau Claire in the statewide data system. So it's a certain challenge that we have, and we're working together with UW Eau Claire, as are all systems schools, to try and make good information available. We are closely connected when we have any positive case, though, that is connected to UW Eau Claire, and are following up on cases and contacts so that we are making sure that isolation and quarantine happens. We also had a question about schools staying in session and what are the criteria for schools not being in session, whether it's K through 12 or colleges. The state recently released a resource for all of us to use, the guidelines for COVID outbreaks in K through 12 schools, but it's very similar for universities and colleges. There is no clear-cut standard to say at a certain point schools should all be closed. The state has not given us that specific metric to say at this level things need to be closed. Like any communicable disease, we will look at the local data, and our goal is always to have the least impact possible. If there is a reason because of disease spread in a classroom, or there is an issue in a classroom because teachers aren't available, we certainly will be working closely with the school to make a determination about what is best for the school and for disease spread in any given outbreak situation. Not dissimilar to what we do all the time with outbreaks in schools. This will be a challenging year as we see how disease progresses, and our goal continues to be keeping circles small. So the more that we can use physical distance and face masks in those settings where kids are together and young people are together, the better we'll be at not having disease spread, and that continues to be our goal. We also had a question related to our testing numbers, and it is in fact true that over the last little bit of time our testing numbers seem to have taken a significant dip. We did talk about that in Incident Command this morning, as a matter of fact, and are working through what the testing data is really showing us. We're hoping that we will have a better understanding of that. It is the end of August, and this is a time when many individuals and families do take a little breather before jumping back into school. We're sure that that is likely part of it. We also know that we have some barriers to testing that we are working through. We have set up a clinic at the Chippewa Valley Free Clinic where we do have testing available a couple of days a week, and you can certainly check our website related to that. And we want to make sure that people get to all of our testing locations that exist with our healthcare partners. So do know testing remains a strong priority. It's going to be one of the best ways that we can have to identify where COVID-19 is and keep the impact of this as small as possible. Our goal continues to be increasing those numbers of tests, and we're working to figure out why that is exactly happening. I think with that, we will pause and see if there are any other additional questions that anybody has in the room. Yeah.
Lisa, I know last week it was reported that in the 20 to 29 age group, that age group continues to make up a higher percentage of cases in Eau Claire County. I think it was up to 47% last week, so basically almost half. How big a concern is that to you, as now we have a whole bunch more people in that age group coming back to school, at the same time that there's a statewide shortage of testing supplies? That seems like it could be problematic. Can you just talk generally to that issue?
Sure. So the question is related to the 20 to 29-year-old age group. Last week we talked a bit about that being a fairly high percent of our positive COVID-19 tests. are in that age group in Eau Claire County, higher than the state rate, and certainly something that we've been watching since the beginning of COVID-19. We do see a large number of cases in that age group. We know it is often related to the behavior of that age group and their social interactions. And it is something that we're spending a lot of time on messaging and working with partners on. UW-Eau Claire and CVTC are two strong partners in that effort, as are many others across the Chippewa Valley. This week, for example, we'll be sharing in our social media accounts and through letters to landlords and letters to students information about social gatherings and how to keep those safer, and really strongly encouraging in those private settings, especially the social settings that many of our young people are involved in, to keep their group as small as possible. It's not necessarily something that we always see in this community, and is something, given COVID-19, that we really need to count on. It's also an age group that socializes in more public settings, whether those are restaurants, bars, or other settings, and we're working with those entities as well to make sure that there is a clear understanding of the shared interest we all have in keeping numbers low. Nobody, the businesses, UW-Eau Claire, the health department, or the community, want to have a big outbreak in that population that really impacts the ability for school to happen. So all of those efforts are happening now, and we're counting on young adults really paying attention and being part of the solution. The challenge is not really just with their own health status. Often they have not a huge impact with COVID-19. The challenge is really who they interact with and who they can spread disease to, and that really then becomes a concern in this community. It's not unique to Eau Claire. We've seen it across the U.S., and it's something that we have to pay attention to. Those young people work in our community, they volunteer in our community, they have internships in our community, and we need to make sure that we are protecting the broader population as well as protecting them. Yeah, go ahead.
What do you guys at the health department doing as far as, with this influx of college students coming in, and how's it getting ready for contact tracing? Are you ramping that up? Are you hearing more contact tracers? What's going on with that?
Yeah, so the question is related to what are we doing with contact tracing as we anticipate UW-Eau Claire particularly starting, as well as K through 12 and the gatherings that will be happening because of that new process that hasn't been going on for the last 5 months. We have hired a number of additional contact tracers and are working on training them and having them on board. That group is following up on all of our cases and making sure that we identify contacts. Again, critically important for us as a community that we do that well. The better we partner together on that, the better we will be able to slow down the spread of disease. We've also partnered with UW-Eau Claire. They have identified a team of contact tracers at UW-Eau Claire that we're actually training today. They went through some training last week, and today they're going through the whole process of how to do contact tracing on the UW-Eau Claire campus for both anybody that's connected to the campus if there was a case that was on campus and connected. So that would be students that are in class there, faculty that are there, and individuals that live in the dorm. So all of the on-campus contacts will be done by university staff, and all of the off-campus contacts will be done by health department staff. A good and important partnership because of the increased volume that will be happening. We also are working with K-12 schools and really anticipating the potential need for support from the schools with contact tracing with if and when we have cases in the schools. So our goal with schools is to not have close contacts happen, but in the event that they do, we'll be partnering with schools to get information out to close contacts and to partner with us to identify who might have been a close contact in those situations. Yeah. Yeah, so the specific question again about the younger age population, that 20 to 29-year-old group, and the wearing of masks as one of the strategies that we have, as well as what they do when they're out in the community, and how to really emphasize that their behavior, what they do, and the choices that they make will make a difference. We are working very closely with the establishments in Eau Claire to reinforce the use of cloth face coverings for anybody that is in those places. Last week we met with downtown and Water Street businesses to talk through strategies around safer practices in those businesses, especially following our order, but really, even if there wasn't an order, what is going to be best practice so we slow the spread of disease. And we are specifically working with some of our businesses that have a higher number of students that attend them and that attend for social reasons and large gathering social reasons, and really working to find creative ways to decrease the numbers that are there at any one time, to increase face mask use, and to really think through how we can decrease the spread in those situations. We also know that if people aren't socializing in the establishments that we have in Eau Claire, that they may be socializing in backyards in large numbers. So we're also really stressing that any situation, know who you're with, know the names of the people that you are with and how to reach them, and keep the numbers of close connections as small as possible. Going into a crowded facility or going into a crowded backyard party is a high risk, and we need to make sure that we are messaging that clearly. Yes?
You just mentioned fewer positive cases in Eau Claire County in the last couple of weeks, and then you also mentioned there were some possible barriers to testing. It does look like the average testing numbers in Eau Claire County have gone down slightly in the last 2 weeks compared to earlier in August and July. Do you have any more information about why those testing numbers might have gone down this slightly?
So the question again is about testing and the numbers that seem to be slightly lower right now than what we've seen in the past. We haven't had any large testing events happening, which do impact our numbers. As everybody knows, we've done a couple of larger testing events, and those test numbers, as they come in, increase our volume of tests, whether it's related to a long-term care facility or to the jail or to another outbreak situation, and we haven't had one of those recently. We also are hearing from healthcare that fewer people are presenting for testing, and we don't know exactly why that is. And so one of our encouragements to everybody again is to remember that those symptoms of COVID-19 are very broad. Anybody that has any symptoms should get tested, and that testing is available. So again, we may be at just a little bit of a curve down where people are paying attention to getting tested, and it's our strong reminder that the more we know where COVID-19 is, the better we can contain that a little bit and keep the circle small. So that continues to be our goal. That will help all of us keep things on a smooth level, and we're working with our healthcare partners and other partners to see if there are additional barriers to testing that we just aren't aware of right now. All right. Thank you very much, everybody. We appreciate your time with us. Again, join us Wednesday when we'll live stream on Facebook, and we appreciate people staying up to date. Again, COVID-19 Eau Claire is your website to get good information, and we'll be back on Wednesday. Thanks.